Hi, I'm Mark Damian. I'd like to tell you about a new podcast series. It's entitled Cancer, How Did This Happen to Me? It provides a view of cancer from the perspective of cancer survivors and those who support them. In this episode, we will discuss my personal experience with cancer, from the initial warning signs to the cancer treatments themselves. Now, the first question that usually comes to mind is, what is cancer and why now? You see, cancer is a disease caused by gene mutations where cells divide uncontrollably and spread into the surrounding tissues. Prostate cancer itself is a relatively slow-growing cancer, and you may not experience any symptoms other than maybe trouble urinating. Now, the risk factors of prostate cancer increase with age. Younger than 50 years old, there's a 1 in 350 chance of a cancer diagnosis. The risk increases to 1 in 52 between the ages of 50 to 59, and at 65 and older, the risk of prostate cancer is 1 in 5. But there is good news. Prostate cancer is the most treatable form of cancer if detected early, and the 10-year survival rate is literally 98%. Now, the key here is not to ignore the warning signs. Having trouble urinating or frequently urinating throughout the day or night, or possibly having blood in your urine are all possible symptoms. But in my case, having trouble urinating was becoming the norm. Some days were worse than others, and I was concerned, but otherwise I felt fine. You see, I had been procrastinating getting the physical checkup since COVID. My doctor had retired, and I wasn't looking forward to finding a new doctor. And any small illnesses that I did have, I usually got treated at the local med clinic. Luckily, Rick, a good friend of mine, and I were having lunch one day early last spring. We were discussing getting older and some of the health issues, and he mentioned how good his doctor was. He suggested I give her a call and told me to mention his name. I left her a message, and she called back saying that she had an opening. Now, to be honest, if Rick hadn't suggested her, I probably wouldn't have had a physical exam. But as part of that exam, I got a PSA blood test. Now, this measures the protein levels produced by the semen in the prostate, and higher levels represent a higher risk of cancer. Now, between the ages of 40 and 60, normal PSA levels should be between 0.6 to 0.7. At 60 years old and older, normal PSA levels should be between 1.0 to 1.5. Now, my PSA score was 13.0, and my doctor said this could be possibly from a urinary tract infection, or it could be from overexertion from exercising. Now, she treated me for a possible urinary infection, and I altered my diet and exercise routine for 2 weeks. I retook the test, and my score came back at 12.5, and that is when I was referred to a urologist for an MRI and additional testing. Now, the urologist ordered an MRI exam and a PSMA PET scan, which uses a radioactive imaging tracer drug that is administered intravenously. This drug binds to the cancer cells to help localize where the cancer resided in my body. The PSMA PET scan confirmed my prostate cancer as shaded areas in my prostate, and luckily, the scan also confirmed that the cancer had not spread outside of my prostate. Now, a biopsy was scheduled, and they took multiple core samples of the 2 shadowed areas. The results of the biopsy determined that the risk of the cancer spreading outside the prostate was high and that should be treated as soon as possible. Now, my initial reaction was a little bit of shock, fear, and disbelief. I was sad and angry, and I was looking for meaning. I was worried for my family, and how was I going to balance my life and work schedules was a major concern. But I was determined to stick to a daily schedule, eating healthier and continuing with my daily workout routines. My focus was not to lose my physical strength and overcome side effects from the treatments. I did my own research, and I had an idea of my treatment options. I could either undergo surgery for the removal of the prostate or a combination of external beam radiation therapy along with hormone therapy. Now, the urologist went over the test results and discussed both of these treatment options. I also got a second opinion from the head of urology, discussing the side effects of both of these options as well. Now, with the external beam radiation therapy, there are scheduled 10 to 15-minute treatments 5 days per week for 5.5 weeks for a total of 28 treatments, plus 6 months of hormone therapy. The side effects is trouble holding your bladder or emptying your bladder, and you could be up 5 to 6 to 7 times per night during that process. I also exhibited some short-term erectile dysfunction and loss of libido. The side effects also from the hormone therapy included tiredness, lethargy, muscle fatigue, brain fog and memory, and hot flashes. Now, if I decided to go with the route of prostate removal, that really is the most expedient way to remove the cancer itself. But there are risks with surgery, and that could be bleeding or infection. And the side effects include urinary leakage, which could be temporary or permanent, requiring diapers for the remainder of your life. Also, long-term erectile dysfunction and permanent infertility were also major side effects to consider. Now, I chose the non-surgical route. Now, the challenges with that was sticking to a restricted diet to prevent the gas in the colon. Now, the colon is located near the bladder and the prostate. Gas in the colon swells the colon and can move around the prostate, making it difficult to receive treatment. You also had to manage a daily water intake because you needed additional water to keep the bladder full enough to lift off the prostate so the radiation beam can kill the cancer cells. They were unable to perform the treatment if the bladder was not full enough. And this came to one of my most humbling experiences during that treatment. In one treatment, I was unable to control my bladder while receiving radiation treatment by drinking too much water prior to the treatment. I ended up urinating on myself during the treatment and jumped off the table and ran to the bathroom, pulling up my pants along the way. It was totally embarrassing, but honestly, there was no judgment, just empathy from the nurses and the patients. Putting this into perspective, watching others undergo more serious treatment, like chemotherapy, surgery, and radiation, my side effects paled in comparison. Their bravery and positive attitude actually inspired me to make this podcast. Now, on my last day of radiation treatments, you ring a bell outside the radiation treatment room to signify you've ended your cancer treatment. Now, my daughter Paris and my wife Lori surprised me that day by bringing in the disco song Ring My Bell and playing that while I was ringing the bell. And then they continue to celebrate by bringing cupcakes for all the staff and the patients that were attending that day. It's very inspiring for me, and I really thank them for that. Now, my hope is by sharing my story, I can help others who procrastinate in getting physical checkups. For example, I waited until I was 60 years old before getting a colonoscopy. In hindsight, I was lucky that I didn't have any major issues. Now, my problem was confusing my physical health with my physical fitness. By delaying those needed physical exams, it can sometimes cause bigger issues. Now, in closing, I'd like to express my deepest thanks for the exceptional doctors, nurses, and medical staff at the Leahy Medical Cancer Center in Peabody. Their compassion, commitment, and support have been invaluable throughout my cancer treatments. I am also incredibly grateful for my friends and family for being there and encouraging me throughout my cancer treatments. Thank you. And to our listeners, thank you for listening. Please consider subscribing, leaving a review, or sharing it with somebody who might find this valuable. Now, we have some great upcoming episodes that will feature inspiring stories from my fellow cancer survivors and uplifting accounts from cancer support organizations within our communities. And as always, if you have any suggestions for topics or guests you'd like to hear from, please drop a message on my website, 50plusstayingrelevant.com, or connect with us on social media. And until next time, take care, and thank you so much for listening. Now, the information provided in this podcast is for general informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Also, seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Now, the views expressed here on this podcast are solely those of myself and do not necessarily represent the views of any affiliated organizations. Thank you for listening.